My name's Liza Edmonds. I'm a neonatal paediatrician and work within the public health system. And so for me, most children who we consider this diagnosis are usually referred for some developmental challenge, whether it's a learning challenge or behaviour challenge or things not following the course that we expect. And so whenever I see children with any of those issues, then we do the usual things, which is take a full history, including a pregnancy history and any medications or anything else that we've taken during the pregnancy, as well as a full examination. And so there's lots of causes for having developmental problems, and included in those causes includes the potential of fetal anti-convulsant syndrome if mum's taken anticonvulsants during a pregnancy. So when you meet a family for the first time, you can't usually come to that diagnosis on the first visit, but it becomes one of those potential reasons why this young person's having problems. And so then going through to try and tease out what could be the potential causes, including anticonvulsant exposure, we've got to do a whole lot of things. So the first thing is that really detailed history, and that can be quite hard because sometimes if I'm meeting a mum and it's been a few years since a pregnancy, she might not quite remember things like doses of medications or when she took them, and so sometimes we have to go right back to the notes, the pregnancy notes, to go back and find out that information, which takes time because it depends on where mum was pregnant. Do you have to get records from another hospital or another department? Then you have to take a really detailed examination, and that can be difficult, particularly if you're looking at a child and it becomes really obvious about what all the challenges are, and making a really detailed assessment of that. At the same time, you've got to make sure that the young person's referred to the right services to get help while you're trying to get to the diagnosis. And you sort of do two things along the same time. One, making sure you get the help, and the second, trying to figure out what the diagnosis is. So the other things that we have to do when we're thinking about that potential diagnosis are things such as blood tests to make sure that there isn't an underlying thyroid problem or, say, a genetic cause that's leading to the developmental problems. We have to sometimes think about things like head scans, so neuroimaging, depending on what the child's got. And all of these things all take time, of course. They take time to arrange, they take time to get results back. The other thing sometimes is often I'll see young people and they might have things, other neurology things, and you might need to ask the neurologist to say, look, I've got this young person who's got these issues. Could they have this diagnosis? Could they have another reason? And so making neurology referrals to paediatric neurologists. And then, of course, we talked a little bit about the genetics things, but often having to make a referral to my genetics colleagues to say, I'm considering this as a potential cause. Is there anything else though it could be? And again, that's another referral and another waiting for another appointment. So at the end of the day, there isn't a special test that can say your child has fetal anticonvulsant syndrome. There's no blood test, there's no test that can say this is it. But at the end of the day, what we do is look for other causes, look at the child and consider it, knowing that we know what the features are, and then make a clinical decision, is the child affected or not. And I have to say it's a really long process, which can be quite rough for families because it seems like it takes forever. But the most important thing is if we've got a really thorough process at the end of the day, we can make that decision together with with all the information about whether or not a child is affected or not, to get the right diagnosis, because I would hate to miss another cause of why a young person's got developmental challenges.